Good evening, everyone, and this evening I am joined by Lizette, who will speak about her research. Maybe you can introduce yourself for our listeners.
Thank you for having me, Alastair. So I'm Lizette. I am from the Netherlands, and I am in my second year of my PhD at FPN here, the Faculty of Psychology and Neuroscience. I'm doing a PhD on HIV prevention in the region.
That's great to hear. Thank you very much. Now, obviously, we'll go to discuss your project in a minute, but maybe you can talk about your journey to getting to this project, because it's quite a important project, to say the least.
Yeah, I've been interested in HIV as a field for a long time, and I volunteered at the AIDS conference when it was in Amsterdam, and then liked that so much that I did an internship with the International AIDS Society after or during my master's. But I studied biomedical and life sciences for my bachelor's, and then global health for my master's, which both of those are very public health related topics, in which I always try to find a way to bring in HIV and to be allowed to study that or to write about that. So I felt really lucky when I saw this advertisement for this PhD, and I still feel very lucky that I get to do it, because it's a really cool project to be working on.
Well, that's great to hear. Now, maybe this cool project you could tell our listeners a bit about.
Yeah. So the Euraregion project is about HIV prevention in the region. The Euraregion is essentially between the, in good English, Meuse and Rhine, so the Maas and Rhine in Dutch, and it includes the Netherlands and Belgium and Germany. So it's very much a border area. And our hypothesis is that HIV prevention requires a different approach here than it does in especially capitals like Amsterdam or Berlin. And that the fact that people here cross the border a lot, even during Corona times, means that there are interactions that we wouldn't see somewhere else. So as the Netherlands has reached some major UNAIDS targets, and Germany and Belgium are also reaching those targets, we're looking to get to zero new HIV infections. And we think that one of the ways to get there is to take a regional approach.
Well, that's really nice to hear. Now, maybe, obviously, that's quite a broad topic you've just introduced. Maybe you can address how you yourself are now going to try and look into this and tackle the problems that the region faces.
Yeah. So we're starting with, or I'm starting, that's my PhD within the project. There's some other things going on. I'm starting with the needs assessment part of it. So we're trying to map what do people want, what are people looking for, what are things that people run across, and problems that people face in accessing testing and treatment specifically. And as a part of that needs assessment, we've just started doing interviews with people living with HIV in the region. So we're looking for interview participants for that very actively. Our interviewer is ready to go on that. And we're also looking to start soon with interviews with other key populations in the region. And key populations is jargon. It's the populations that are considered by the WHO, by UNAIDS, to be of higher risk. So it's more prevalent amongst those populations than amongst the general population.
Now, in the past, I've spoken with people on similar topics, and there seems to be a recurring theme. How do you really access these groups? Because there are maybe some people you can reach, but the reason it's transmitting to some extent is because these people don't have the necessary medical tools. So, and you're in part researching what are the necessary medical tools. So how do you find out what they are? It's almost a dichotomy.
That's a big question, right? Because there are several parts to HIV prevention. There's treatment as prevention, which is that people that are living with HIV, when they are on antiretroviral therapy, so they're taking medicine for HIV, they get to a point, usually not 100% of the time, but get to a point where there are no longer any virus particles in their blood. So they can't transmit the virus anymore because of that. And so that is one part of it, right? If you know that somebody has HIV, is living with HIV, if they've been diagnosed, then they should, or you hope that they can access care for that. And that is helped by providing easily accessible care and care that is free or very cheap, and by providing care that is not stigmatizing or discriminatory in any way. Finding people that don't know that they're living with HIV can be very, very complicated. And that's what we're trying to also do a social media intervention for, to see if we can reach people that haven't been reached by previous interventions. So we've reached the 90-90-90 target, but the last 10% is probably going to be the hardest, because this is not the people that that are eager to get tested, maybe, and there is still a lot of stigma, and especially in a region that's as diverse as this region, there's a lot of different ways in which people come to care, and we should honor those ways and try to, do our very best to reach people in different ways.
Now, there's a lot to unpack there, but I'm going to start with this. You say social media intervention. Should we be expecting to see TikToks from you anytime soon?
Definitely, yeah.
Now that's slightly more
I'm
boring, just saying yeah.
It's like amazing dance, or I'm very old, you can tell. The next planking is going to be invented by our lab. I don't know. We're trying to see if we can get it to be very interactive, and I don't know that TikTok is the best place for that. I think it might be more in, especially because there's a range of ages and backgrounds of people that we're trying to reach. So we know from experience and from literature that targeted interventions are the most effective. So probably we're going to be diversifying and seeing what works and what doesn't work by what kind of feedback we get from interview participants and from the community, from people that respond to our posts, hopefully.
So it sounds like we need to hold off before we see any new dances from you then.
If that's what people want, then that's what they'll get, absolutely.
Okay. One vote for TikTok dancers here already. But
maybe it'll be like the new Reddit, am I the asshole? Who knows?
Maybe. But then obviously you've put some thought into this. How do you foresee developments in this regard? I mean, will it be kind of more web-based stuff, or will it be more like traditional social media platforms that you're looking to use?
I'm not an expert on social media at all.
Okay.
So I'm trying to learn about that, and it's a steep learning curve because it's a world that changes very, very fast. I don't know what it's going to look like.
Okay.
I have some thoughts about it, and things that I think might work and things that I think might not work. But to me, the most important thing is to set it up in like an honest and sort of forthcoming way, to make sure that the information that we provide is, definitely accurate and easy to understand, translated into different languages, that it can be found, so that we can help people that are looking for this information at least to navigate.
Now, maybe it's time that I'm nice to you and we move back to an area of your expertise. You spoke earlier about how the region faces very different problems to, say, Amsterdam or Den Haag. Maybe you could expand on the kind of problems that are really faced in the region in regards to prevention and elimination compared with in the major cities up north.
Yeah, and one of the ways that we see differences between the region and definitely in the Netherlands, like the Randstad area, is sort of a sense of queer culture where there's not this sense of, you don't move to rural Limburg to be free and queer in the way that people moved to Amsterdam to be free and queer.
You might not, but I definitely did. I was like, this is queer paradise.
I'm really glad that that worked for you. I really am.
It's not. I'm sorry. I mean, it's got fields, and presumably somewhere there's kind of like cottagecore vibes. So
Yeah,
there's definitely
of course.
some queerness, maybe just not the rainbow explosion we all think of the Netherlands as.
Yeah, and we think that the language barrier here might have an influence on, or like the language barrier is not inherently present, of course, but that because it's an area where people travel across the border a lot, that there will be a language barrier, and obviously like the navigation of different healthcare systems and between those systems and between languages, but definitely also that queer culture aspect, migration, but also the place where most NGOs are active is the bigger cities, because there's more people there and there's more of a sense of need in bigger cities sometimes. So I don't know if you're familiar with interventions like Mom Talk Mom, which is great, and it's only for a limited number of cities.
Now, obviously, it's very idealistic to think of the region as a proper region because, well, there's some things where actually it is centralized. Predominantly, it's a Dutch province, a Belgian province, and a German province working in their own way, maybe collaborating on some things, but it's not the same kind of thing as if it was tackling a solely Dutch issue. So do you find that there is differences in the way that Belgian, Dutch, and German authorities try and address this problem?
I definitely think that there's a difference in how they address the problem. I do think that that's not how I would define a region per se. I don't think it needs to be delineated by borders to count as a region. I think it has to have some sense of similarity, and I think that in that sort of cross-border experience, there is something that people in the region share, and that you can call it a region because of that.
No, I'm not questioning the nature of the region, but more the fact that actually there are governance structures within the region, and some of those structures are Dutch, some of them are German, some of them are Belgian. So the fact that the region spans these three countries isn't a problem per se, but when you then go, let's eliminate HIV within the region, presumably you've got the Dutch going, let's do it like this, and differences from the Belgians and the Germans to their own viewers.
For sure. No, and healthcare systems are different across different countries and within different countries, even between different provinces, especially in Germany. I would say we're not just looking at one province in Germany and one in Belgium. It's two for each and one for the Netherlands. But my colleague Hannah, who joined us as a postdoc 2 months ago, is doing really great work in setting up a network among partners, and some collaboration is indeed already happening. Specifically with Corona now, there's been a lot of, okay, we really need to get a move on this because viruses aren't stopped by borders, as Corona has shown us time and time again. So there's a sense of collaboration within the region already that hasn't extended to sexual and reproductive health much. And that's what one of the things that Hannah is also working on.
Well, that sounds like at least there may be a solution on the horizon. But you said you'd started with interviews. How far through them are you, if there is, in fact, an end point that can be categorized?
Not very. It's qualitative research, right? So we're going to keep going until there's saturation. Not very far, no. So I can't share any findings with you yet.
But I mean, do you think that it's going in the right direction? Have there been any major surprises as of yet?
We're really nowhere with that. Oh. So it's only just begun, the interviews. And yeah, I'm looking forward to those surprises.
Okay. What would you, presumably then you spent the last 2 years doing a kind of literature review of things?
No, this is just the beginning of my second year, so it's been a year and a bit for me. I actually also did a little side project. I helped another colleague, Mark van Dijk, with his survey. He did a survey among men effective men about prep. Sorry, I have to cough. Yeah.
Take your time, it's fine. That looks more like a giggle than a cough.
Yeah, it was not. It was definitely a cough. He did a survey with about prep uptake, and but he just finished his PhD, so he was writing it up, and Corona was changing everything. So we did a sort of a forced measurement of his longitudinal study, and I have also been working on creating that survey, disseminating it, data analysis, doing the write-up. I got to present about it at a conference, so I've also been doing some of that.
So COVID scuppered your research.
Yeah, and obviously, like trying to learn as much as I can about the region and about the things that are already happening, and yeah.
But do you think then that there's any like major interventions that you think, from obviously your quite extensive experience working with HIV prevention, that are lacking in the kind of Euro region, that will be almost picking low-hanging apples, making sure that really help is delivered where it needs to be, or do you not know? Will it be a mystery?
I think there are things that we think of as a sort of low-hanging fruits, right? And that's easy to navigate care, for example. I think it might make a big difference to, for example, provide all information about getting tested for any STI available in all the major languages of the region. I don't know what the impact of that would be. I didn't measure it, right? I think it would help to not limit who can access testing or treatment in specific countries by where people are from, but that would require a major overhaul of our healthcare system. I think we're more on the politics side than on the what I'm trying to achieve with my research. But I think trying to address that language aspect, that would make a difference, especially because obviously there are also people in the Netherlands that don't speak Dutch, and you can't find information in English, then that already limits a lot of people from being able to access specific care.
And you just mentioned there you're not doing a politics PhD. Obviously, your PhD project is very health related, but it does have a lot of almost interdisciplinary angles to it. How do you navigate all of that?
I like it. It's a FPM, right? And I didn't do a bachelor's or master's in it. I did more of a medical first, but also a geography minor because I like that a lot, and then health, which is more epidemiology, but also a lot of social sciences. I really enjoy that. I think that a monodisciplinary approach to something as complicated and you can't take the person and the virus away from each other in any meaningful way, right? You can obviously there are people that are doing fantastic work of trying to find a cure and trying to find a vaccine for HIV, and that's really the biomedical side of it. But my colleague Tamika is doing research on HIV cure and how the community feels about this. How do people feel about the fact that there keeps being these messages in the news about a cure maybe being closed? What kind of impact do they think it will have on their lives? And that's, again, a very personal approach to something that is often thought of as purely biomedical. So I think an interdisciplinary approach is necessary in a field like this, and it makes things more complicated sometimes. But I really do think it's the right thing to do.
It really should not have been my immediate thought, but my immediate thought when you said that was, will HIV be missed? Will we need to throw out a leaving party? Which should not be the immediate thought you have of like, will there be a cure? But that was it.
I mean, if we get a cure, really, really soon, right? Let's say that it's in all the papers tomorrow that there is a cure that is totally 100% effective. That doesn't mean everybody has access to it. Very specifically, a small number of people are going to have access to it. As we've seen with the vaccine for COVID right now, I can order self-tests to my house and they'll be here tomorrow and I can do them with no issue, but that's not how it works in the rest of the world. I'm getting my first shot for the vaccination tomorrow. That's not how it works in the rest of the world. And those disparities are sort of, yeah, HIV can show you that they exist, but they are independent too, right?
I mean, all you need to go is, well, actually the treatment for HIV is most definitely not a cheap treatment, but it is accessible to a large part of the Western world. But then if there was a cure, the cure would go to them first, and you're leaving large swathes of people who don't even have access really to the top-end treatment, put back probably decades, while everyone in Western Europe with decent medical systems will hopefully have it relatively soon, if it was to come out tomorrow. But unless you know something I don't, it probably won't.
That would be my prediction too, but I don't know how that would go. I keep hoping that we will learn things from the situation that we've seen with Corona and how we've decided to allocate who gets the vaccine and who doesn't.
You say hope. That doesn't sound very optimistic.
I'm a hopeful person. I try to keep hoping that we will learn.
So you said now that you're just under, or coming into your second year. So obviously you've got several years to think about these problems. But have you given much thought to what will happen once you're done? Once you've escaped? Once you've solved it all?
I don't think I'm going to solve it all in my lifetime.
You just said you were hopeful.
I'm hopeful that the global community will be able to do the big things that we're doing. And
so are we not expecting a Nobel Prize in medicine for you anytime soon? Is that not your aspiration?
Definitely not in medicine. No, that's not my goal. No, I'd like to be a part of this field for a long time. I really, it seems like a strange thing to say, right? I enjoy it. But I enjoy this work. I find it important, and I find it fascinating, and it's something that gives me energy, and I feel very passionate about it. And I hope to be able to be a part of this field for the rest of my career. And I don't know how that's going to look like. I'd love to be doing research, but I also am finding out that I really enjoy teaching, and I wouldn't mind at all making that a larger part of my how I spend my week. So I'm flexible, but wanting to stay in the field for sure.
Now, you say that your presence in the field gives you energy. How do you almost navigate the fact that interviewing people from such a community at risk of HIV, or either at risk or having HIV, must be quite an emotionally demanding thing to do?
I'm not doing interviews with people living with HIV myself. We have.
You got out of that one.
No, not out of it. I would really enjoy to be. I really enjoy interviewing. Honestly, I really enjoy interviewing. It's the answer to your question. It can be emotionally draining and it can be sad, but it's almost always, in my experience so far, also just a really cool experience of connecting with another person. And I'm not doing the interviews with people living with HIV. We are working together with an interviewer, Robert Whitlock, who's doing that. He's a person living with HIV himself, and he's familiar with the community. He's very, very good at interviewing, and I had the pleasure of doing a practice interview with him, and it was really great. So that definitely, when you're working with vulnerable populations, that is always something that you have to keep in mind, and something that I try to be aware of, but also be aware of the fact that there's a lot of resources and information on how to work with vulnerable populations that I haven't had a chance to get into, right? There's a lot for me to learn on that too. And my co-promoter, Sarah Sutherland, works with this a lot and sends me articles about it. And when I read, there's so much happening on this. This is great. So, yeah, doing research on people, I think, isn't the right way to approach it. It should be with people, right? It should be a collaborative process where you get input, but also where you look into the things that the community wants to know, that people are interested in knowing.
Now, obviously, as you're not doing the interviews, how do you think that impacts your ability to then almost work with that output?
Actually, talked to Charlotte about this, who you spoke to recently as well. And she said that she feels like she's done the interviews that she didn't do because she's listened to them so many times. And I'm hoping to have a similar experience, that I'll feel as into it. But I do think that this is the right approach. And so I'm really glad that this is how we've managed to set the interviews up. I'm also really looking forward to doing the interviews. I'll be doing the interviews with the key populations that are happening later. And I am looking forward to doing those. I enjoy interviewing, and I look forward to getting better at it by practicing.
Now, we come to the end of our half hour, and as you told us you couldn't give any of the juicy goss away, is there anything that you think you've learned or didn't expect it to be like when you started your project?
I thought I wouldn't enjoy the networking part of it. There's a big part of the project that is about collaborating with different partners within and across the different countries in the region. And I thought I wouldn't enjoy that part, and I'm actually finding it fascinating to find out what people are doing and how they're doing it, how they're thinking about it, how they're approaching it, and the different cultural aspects that play into that. And I might be enjoying it a bit much. I also have to do my actual work, of course, but I'm really enjoying the collaboration part of it and thinking about how we can collaborate with different partners, and thinking also about how I could then share that information through social media or through a blog or the website that we have with other people.
Well, thank you very much for that and all your other answers, and for giving us your time this evening.